Hey y'all, Robin Nicole here. Welcome to another video. This is going to be less of a vlog and more of just a chit chat. For those of you guys who are new here, I am a first responder. I am an emergency medical technician in South Carolina. I'm not going to say who I work for because of privacy, also because as with any business, I don't want to misrepresent my company in any way. I love the company I work for, but that's not why we're here. I just want to talk to you guys a little bit about what it's like being a healthcare worker during a pandemic. This is just my personal view. This doesn't necessarily reflect what things are like in other parts of the country or other parts of the world, but this is just kind of what I've experienced firsthand, and I guess also kind of some stories that I have heard from other first responders that I personally know who are in other places around the state and around the country. So today is, I believe it's April 28th, and we are a couple weeks into this thing here. I know for many of you, it has been a few months already. South Carolina just put a stay-at-home order into place on April 6th. 10 days into that order, our governor, Henry McMaster, went ahead and reopened boat ramps. And a couple days after that, he started to reopen some non-essential businesses, including arts and crafts stores and stuff like that, that had been previously closed down. So that's kind of where we're at right now. Some parks are open, some aren't. That's kind of being left up more to local municipalities, but that's kind of where we're at. As a healthcare worker, this is a very weird and trying time. I 100% approve the stay-at-home order. I think it's way too early to lift it, even based on the guidelines that the White House has put out. We are nowhere near being ready to reopen. The White House says that numbers need to be decreasing for at least 14 days before reopening. We're not seeing that here. We are still seeing our numbers rising every day, so I'm honestly not sure why some things are starting to reopen already. And as a healthcare worker, it's very frustrating. It feels like being stabbed in the back. The whole purpose of social distancing is to flatten the curve. So what does that mean? We've all heard this term. I think a lot of us know what it means, but let me just go over it real quick. Flattening the curve is not about taking away your rights. It's not about taking away your freedoms. It is about doing what is right for society as a whole and taking care of the most vulnerable among us. It's also about lifting the burden on the healthcare system. We are so overwhelmed with critical patients that we don't have the capacity to take on much more. And that's what it's about. It's not about stopping the spread of the virus. It is about slowing the spread of the virus until we have the capability for more testing, until we have a vaccine, until we, can figure out if once you get it, you're immune and you can't get again. And if herd immunity is a thing, that's great. Right now, we don't have evidence of that. And there are some cases coming out in other countries that are actually showing that you can get it, you can fully recover, and you can get it again. So herd immunity may not even be a factor in all of this. So my view, what I've been experiencing with EMS, emergency medical services, we always have these kind of weird ebbs and flows throughout different periods of time, throughout different seasons. And we've seen a lot of that lately. We have weeks where it seems like we're not getting any patients at all because People aren't going to the hospital when they really need to. People are avoiding the hospital because they're afraid that they're going to get more sick if they go to the hospital, which is a valid fear. I get that. And there are other weeks where it seems like all we get are critical patients. We have these COVID patients that have been doing okay at home, and then all of a sudden they're not okay and they need our help. And we transport them to the hospital. And normally, when you have like a really bad call, you have time to kind of like slow down, process, recover. Like it's emergency medical services. We're gonna get bad calls. But this is different because it's like bad call after bad call after bad call over and over again. And we don't know how long that's going to go on for. We we're lacking in personal protective equipment, which is a huge thing that contributed to the stay-at-home order, that contributed to these social distancing mandates. We don't have all the equipment we need to properly protect ourselves and our patients, and that's kind of scary. I know a couple of the hospitals I've been into lately, some of them are telling their nurses that they get one mask for their full 12-hour shift. Other hospitals are saying you get one mask, it better last you the whole week. My personal experience, we had enough masks. We were doing good. We were switching them out between every patient, which is what we would do under normal circumstances. Because of the PPE shortage, the Center for Disease Control and Prevention went ahead and changed the standards so that we can reuse masks. That being said, it is not safe. If I am with one patient, I have my mask on, and we're breathing in the same air. Their particles get on my mask, and then I wear that same mask with another patient. That's actually contributing to the spread of the virus. We did have a short period where our supply got very low, and they did tell us to reuse masks. Since then, we have had some relief thanks to the county donating some masks to my company, and so now we have the ability to use them properly. That being said, there are a lot of places where that's not happening, and it's not only harmful to our patients, but it's harmful to us as well. And the thing about this is, as healthcare providers, we are being exposed to this virus over and over and over again. And even if you don on and don off all of your equipment properly, if you're reusing that equipment, there's a good chance that you are going to contract the virus. And we're seeing that in places like New York. And what happens when the healthcare workers get sick? There's no one to take care of the sick people anymore. So again, that's what the whole slowing, flattening the curve is all about. It's not flat here yet. It's still growing exponentially every single day. So that's what we're really trying to stop. And it's a difficult place to be in. I know another thing going on in New York right now is, and really all around the country, we are trying to stop doing aerosolized procedures as much as possible, because that increases our risk of contracting the virus. But in places like New York, they're actually being told that they cannot do CPR on anyone, even if they do not have COVID. If someone goes into cardiac arrest, my coworkers who are up in New York are being told not to do CPR. They're being told not to revive them. So people who on a normal day would have a heart attack and would be able to fully recover from that are dying now. We also have people dying because they're not coming into the hospital when they need to be. We have people unnecessarily dying from, again, heart attacks and strokes is a lot of what we're seeing, because on a normal given day, you have a health emergency, you call 911, the ambulance comes, we treat you on scene, we treat you en route, we hand you off to the healthcare providers at the hospital, to the doctors and the nurses and the respiratory therapists and everyone there. Shout out to you guys. You guys are doing the brunt of the work right now, and we cannot do this without you guys. So shout out to respiratory therapists especially. So yeah, that's kind of what we're seeing. I think I gave an example in a vlog a couple weeks ago, but I will go ahead and use it again, is we have patients who, okay, you have a tiny cut in your arm, not a big deal, but it starts to get infected. On a normal given day, you could make a doctor's appointment, go to see a doctor, get a prescription for antibiotics, not a big deal. Right now, people are having problems doing that, and so they're trying to treat it at home, or they're not doing anything about it at all, and so the infection grows and it grows and it grows, and then they realize, hey, this is an emergency, I need some help, and by the time they get to the hospital, they're already in critical condition, they're getting septic, and the only thing that the hospital can do for them at that point is to go ahead and amputate. So we're seeing people come into the hospital with more things like that because they're delaying care. Yeah. Sorry for the pause there. My dog got into something he wasn't supposed to, and I had to go stop him. Also, I apologize that this video is vertical instead of horizontal. I just realized that I had my phone the wrong way, and I'm not gonna try to re-record everything I just said. So, moving forward, my kind of experience with COVID-19. Like I said, some days we are kind of overwhelmed with critical patients. Other days we aren't getting a lot of calls and are being sent home early because there's no point in us having, 4 trucks up and running when we've only had 2 calls in, an 8-hour period. Again, I work for a private company, which is totally different than working for a county. We usually get a lot of calls, and we're not getting the call volume on some days. On other days, like I said, we're being overwhelmed. So it's kind of hit or miss day to day what it's going to be like. We are seeing an uptick in a lot of psychiatric patients, a lot more people coming in for anxiety and depression. So I just want to go ahead and say that if you are struggling with those things, please reach out for help. I will post some links down below for some resources for you guys. Please take care of your mental health. I know these are very trying times for all of us, so just be aware of what is going on in your own mind and in your own body, and do what you can to take care of yourself. And if you need to reach out for help, please reach out for help. We are seeing, like I said, where the healthcare providers are getting sick. Earlier this week, I believe it was on Wednesday, we had a moment of silence for a coworker that died from COVID-19. We are not immune to it. We are humans too. We are dealing with the same emotions as all of you guys, and it's difficult. It's hard to, as I'm sure a lot of you essential employees out there, regardless of what kind of job you work in, it's hard to go to work knowing every day that you're potentially risking your life. And for all first responders, I mean, this isn't just specific to a pandemic. This is something that as first responders is kind of something we experience every day, but I think there's kind of a heightened, increased awareness of it right now. We deal with a lot of other highly infectious diseases in EMS. You guys know lots of firefighters and police officers are unfortunately killed in the line of duty. Stuff happens, and on a normal given day, as healthcare providers, when it comes to infectious diseases, normally we have the supplies and the equipment to protect us. But again, as we're reusing things, that's not necessarily happening. Also, with the whole aerosolized procedure thing and changes in CDC recommendations, we are not wearing N95s for every single COVID patient. We are wearing regular surgical masks, which are not as effective, and we are only using N95s when we have to do an aerosolized procedure. So, like if someone's on a ventilator, which for my company, you're really only going to get that when you're doing inter-facility transports. I'm not sure how the county is handling that right now with people who are on home ventilators that need transportation to the hospital. I'm not sure how they're doing that, but we mostly see it in inter-facility transfers or taking someone home who has a home vent. Yeah, I'm not really sure what else to say right now. I think that our numbers definitely need to decrease. I agree with the White House standards that, we need to see decreased numbers continuously for 14 days in a row before it is safe to start reopening things. I think that's a good guideline to go by. Right now, I know many of you guys are probably bored and tired of being stuck at home, but just hang in there. Things will get better. We will overcome this. This is a pandemic. It's not going to go on forever and ever. And the things that we're doing right now, the social distancing and trying to flatten the curve, this is nothing new. Again, this isn't the government trying to take away your rights. This is the government trying to protect the people. And if you're having a hard time believing that, go ahead and do some research on the 1918 Spanish flu pandemic, because everything we're doing now has been done before. And guess what? Things went back to normal. And for us to we will find a new normal that is, outside of this pandemic, and we will find a cure. We will find a vaccine. It is in the works. It is on its way, and right now we just have to hang in here and do what we can. So, stay home, stay safe. If you have to go out for necessities, go ahead and wear your cloth face mask. It's not as effective as a surgical mask or an N95, but it does help decrease your chance of contracting or spreading the virus. Also, go ahead and make sure you are washing your hands regularly, sanitizing high-touch areas. I know it is difficult to find hand sanitizer, Lysol, Clorox right now, but just kind of do your best part. Soap and water work great on countertops too, so do what you can. Thank you guys for watching this video. I hope that it was informative in some way. If you guys have any questions, leave me some comments down below. I love to hear from you guys. If you're not already subscribed to my channel, go ahead and give me a big thumbs up. Subscribe to my channel. When you subscribe, hit the bell to adjust your notification settings to make sure they're on so that you get notified every time I upload a new video. And I will see you all again next week. Bye guys. Stay safe.